Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Are you among the 4 in 5 adults who don't have enough vitamin D, unknowingly allowing your risk of colorectal cancer to soar? Welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster, and in the next few minutes, we'll explore how optimizing your vitamin D can dramatically lower your chance of colon cancer.
I'm Alara Sky, and this conversation matters because colorectal cancer claims nearly 930,000 lives each year. Worldwide, 1.2 million new cases emerge annually, making it the second most common cancer in men and the third in women. The latest review of more than 1.3 million participants shows a clear pattern: higher vitamin D, lower cancer risk, up to 58% in women. We'll walk you through the evidence and the practical steps you can take today.
First, size matters. This review pulled data from 50 studies covering more than 1.3 million people across the United States, Canada, Denmark, and beyond. Despite their differences, the same result emerged. Low vitamin D equals higher colorectal cancer rates. But remember, colorectal cancer often develops silently with vague signs such as abdominal discomfort, blood in your stool, fatigue, or unexplained weight loss, signals many people overlook until the disease has advanced. Ilara, break down those numbers.
Participants with the highest vitamin D intake or blood levels consistently showed far fewer colorectal cancers. Women in the landmark 1996 Nurses' Health Study who consumed the most vitamin D faced a 58% lower risk than those consuming the least. A 2021 meta-analysis added that higher blood levels brought a 39% reduction, and people who kept their levels high over time enjoyed a further 20% risk drop. The signal is consistent and compelling.
And yet, deficiency is rampant. A survey of 5,600 adults found nearly 80% below sufficiency, with 42% frankly deficient. Blood levels under 20 nanograms per milliliter. Another 37.6% linger in the insufficiency zone between 20 and 30 nanograms per milliliter. In practical terms, 8 out of 10 listeners may be walking around with less than half the vitamin D. Your immune system needs to keep colon cells in check.
Exactly. Older adults, people with darker skin, anyone with limited sunlight, and those managing chronic illness are at heightened risk. Study lead author Dr. Monica Fekete reminds you that vitamin D isn't a substitute for screening, but it's an easy, modifiable factor you can control right now. Ignoring it leaves you unnecessarily vulnerable.
Let's dig into how vitamin D exerts its protective effect. This isn't statistical coincidence. What happens inside your colon cells when vitamin D is plentiful?
Vitamin D binds to receptors in your colon lining, triggering signals that slow abnormal cell growth, prompt unhealthy cells to die, and calm inflammation. It also activates NRF2, shielding your DNA from oxidative stress, two crucial defenses against tumor formation. Animal studies show that this pathway even delays certain age-related changes, highlighting vitamin D's broader protective role.
There's also a gut connection, right? Maintaining the barrier that keeps harmful microbes out of the bloodstream is key.
Correct. Vitamin D and its receptor maintain intestinal barrier integrity and modulate immune responses. Metabolites from your gut microbiota can regulate the receptor itself, while vitamin D shapes the microbial community toward a less inflammatory profile. When vitamin D is low, that barrier weakens, inflammation rises, and cancer risk climbs.
Genetics complicate the picture. For many listeners, a parent or sibling with colorectal cancer feels ominous. How does vitamin D help people with a family history?
The Danish Diet, Cancer, and Health Study found vitamin D offered even stronger protection in participants carrying high-risk genes. If colorectal cancer runs in your family, reaching optimal vitamin D isn't optional, it's life-saving.
Precancerous polyps are another part of the story. What did the Canadian supplementation study show?
Taking vitamin D reduced all colon polyps by 33% and high-risk polyps by 43%. The Iowa Women's Health Study also showed a 15% drop in colorectal cancer when women combined vitamin D with calcium. Because many cancers begin as polyps, preventing their formation is a major victory.
Listeners are likely wondering what numbers to aim for. Blood testing is straightforward, but what target range supports cancer prevention?
Aim for 60 to 80 nanograms per milliliter. Levels under 40 nanograms per milliliter leave you vulnerable, and anything below 20 nanograms per milliliter is outright deficiency. Test twice a year, adjust sun exposure or supplementation, and retest after 3 or 4 months until you hit your goal.
Sunshine is nature's vitamin D factory, yet many of you aren't getting enough. Some avoid the sun out of concern or due to indoor lifestyles, but gentle, consistent exposure remains vital. How can someone safely harness the sun?
Expose bare skin to direct midday sun until it just begins to turn slightly pink, then step out. Your body can make up to 25,000 IU this way and stops production once saturated, so there's no overdose risk from sunlight. Remember though, seed oils rich in linoleic acid make your skin more prone to damage. If they're still in your diet, take extra caution and consider protective steps such as astaxanthin, niacinamide, or a short course of baby aspirin as outlined in the article.
For northern latitudes or winter months, supplements become essential. Supplements can't fully replace sunlight's other benefits, but they're a reliable backup. What form and dosing guidelines should listeners consider?
Choose vitamin D3, the same form your skin makes, and take it with a meal containing healthy fat, like grass-fed butter, to enhance absorption. Balance it with calcium, magnesium, and vitamin K2 through whole foods. Dosage varies. That's why testing, not guesswork, guides your personal plan. If eliminating seed oils is challenging, supplemental D3 can bridge the gap while you transition.
The article also mentions a novel approach, pentadecanoic acid, or C15-0, to speed clearance of linoleic acid from your skin. While it doesn't replace vitamin D, how does that fit in?
C15-0, found in raw grass-fed milk, may accelerate the removal of seed oil residues, shortening the cleanup from years to as little as 12 to 18 months. While more research is emerging, it underscores how dietary choices and vitamin D work together to safeguard your colon.
Vitamin D's benefits don't stop at the colon. Researchers note its protective effects against other cancers, including breast, prostate, bladder, glioblastoma, melanoma, squamous cell carcinoma, ovarian cancer, multiple myeloma, osteosarcoma, and head and neck malignancies, largely through the same mechanisms of inhibiting growth and preventing metastasis.
Exactly. While vitamin D isn't a magic bullet, it's a low-cost, widely accessible tool. Pair it with fiber-rich, minimally processed foods that nourish your microbiome and limit seed oils that drive inflammation. Together, these measures make it harder for cancer cells to develop.
That brings us to today's challenge. You have clear numbers, practical steps, and compelling science. The question is, what will you do with it?
Your challenge is simple. Schedule a vitamin D blood test this week. Note your result and craft a concrete plan, sunlight, supplementation, or both, to reach 60 to 80 nanograms per milliliter. Track your progress, support your gut with whole foods, and retest in 4 months. Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.